Bună dimineața! Nu putem vindeca boala obezității, dar o putem controla, ceea ce înseamnă că astfel putem interveni în bolile care ucid. Nu putem doar să le cerem oamenilor să mănânce mai puțin și să se miște mai mult, pentru că acesta nu este un tratament pentru boală, dar putem avea diete mai sănătoase și mișcare zilnică, ceea ce ne face să trăim mai mult și mai bine. Profesorul Carel Le Roux ne dă detalii importante despre obezitate.
Is obesity more of a personal choice or a disease?
So we now understand the science has changed, and it shows us that obesity is a disease of the middle part of the brain. This is the bit of the brain that we can't control by thinking, but it's the part of the brain that controls how many fat cells our body wants to carry. And therefore, if we treat that part of the disease, then it comes under control and people naturally lose weight without effort.
What does obesity mean for you?
So in the old days, obesity meant, becoming fat from eating too much. And therefore we tried to make people eat less. But now we understand we were wrong. And now we understand that the disease of obesity makes people eat too much. So when we treat the disease, they naturally eat less. And that's what's so interesting, that it's, again, people like the food that they're eating. When you treat the disease, they can do it in the long term, and therefore you can sustain the benefits.
Because the obese people think that the diet is a nightmare.
And that's the problem. So the minute you start a diet that calorie restricts yourself, then you become hungry. And you're thinking about food all the time. And nobody can remain hungry for the rest of their life. So if we give a good nutritional therapy or a good exercise therapy or medication or surgery, what then happens is people are able to eat the foods they like, but they eat less of it. And they're not thinking about food all the time, and therefore they feel released. And they say, this is amazing because I have 25% more brain space. I can just do other things. I'm not thinking about food all the time.
How does obesity impact health and longevity? Because that's what all of us want, to live a better life, a longer life.
And you're so right. If we have a nutrition therapy, it must be something that people can do for the rest of their life. So they must like the food that they eat, and that food must make them feel less hungry and more full. And equally so, if we're going to use medication or surgical treatments, it must allow them to live longer and better. But what's interesting is the thing that people come back with and say, the most important thing I've had is since I've started this treatment, I can move easier. I can play with my children or my grandchildren, I can walk upstairs, I can carry the shopping. So you see, it really drives their quality of life.
If we are talking about diseases, what's the common disease that is related with obesity?
So there's more than 220 diseases that are the consequence of obesity. Now, some of it could be metabolic diseases. Those are things like diabetes or heart attacks or even cancer. Other diseases are functional diseases, for example, muscle pain, knee pain, or even sleep apnea. And of course, there's also mental diseases, increased anxiety, increased depression. So when I'm treating a patient, one disease isn't more important than another. So I want to help and treat the disease of obesity so I can prevent the complications, or even if they have the complications, make it a lot better. Now, when we're given good nutritional therapy or medication or surgery, it is without effort. Now, that doesn't mean people shouldn't have a healthy diet or they shouldn't have a healthy exercise, but again, it's for health, not for weight. Now we can treat the weight. So that is a big change that has happened in the last 5 years.
Do you have a message for the Romanian people to have a longer and healthier life and, of course, not suffer from obesity?
Yeah, so my message should be that, if you develop the disease of obesity, it is not your fault, but it is your responsibility and my responsibility as a doctor to find a solution. So please just reach out to your doctor. Ask if they can help you, because right now they will have better nutritional therapies, better medications, and even surgical treatments that they can help you with.
Thank you very much.
Thank you.
Așa că vă doresc mai multe mese sănătoase și mișcare cât cuprinde, mai ales după aceste sărbători care sper că nu v-au adus kilograme în plus. Și până data viitoare, sănătate multă!